So how can we limit the vulnerability of poor communities during outbreaks like Zika? To discuss this, we're joined by Dr. Kate Tulenko of IntraHealth International. She's Vice President of Health Systems Innovation there. We look at Brazil and these tough challenges there. Can you talk to us a little bit about some of the biggest challenges you're dealing with in communities like this?
Certainly. Well, from an environmental point of view, any disease that is linked to the environment will affect the poor more. For example, they tend to live in marginal environments or neighborhoods with worse infrastructure. For example, the roads might not be paved, so there are more potholes where mosquitoes breed. And they don't have the money to afford air conditioning or window screens or bed nets to protect themselves. Also, the poor tend not to have the access to the information they need to protect themselves.
You know, it's funny, you talk about potholes and you look at infrastructure. There's not a lot of innovations there, but in terms of health innovations, what are some things that are happening on the ground and what kind of difference can they make?
Well, they can make a big difference. Most innovations tend to be based these days around the mobile phone, the use of the mobile phone, which has been the most rapidly adopted innovation in the history of the world. And there are methods now, especially using community health workers, to enable the information to get out to communities as fast as possible, and also to enable health workers to report new cases and to get the data they need to do their jobs.
It's really interesting, the phone, because I've talked to other people who work in developing countries where it makes a huge difference, doesn't it? And you don't think of, you think of the phone as the object that you make texts or you make phone calls, but it's been a game changer, hasn't it?
Yeah. Well, the standard smartphone now has more power than the Apollo mission computer, so they're really quite powerful. But many of these communication systems even work with a standard Nokia type phone, and it's all about getting information down to the last mile.
Talk to me about health innovations and this delicate balance where NGOs have to work with governments, and you've got so many players involved. How does that work? How do you get them all involved, all on the same page moving forward?
A lot of that starts at the coordination level, usually at the national level, but it has to get down to the local level as well. And there are innovations that are cost effective for addressing poverty. For example, the Gates Foundation, the World Bank, they invest heavily in financial systems for the poor so they could have access to credit, also investing in girls' education and improved seed and farming techniques for poor farmers.
Talk to me about how you see this thing playing out, because we keep hearing about cases popping up here and there. You can't get rid of the mosquitoes overnight. They're there. How do you see this thing playing out?
Well, one thing we have to do is look at the cost of doing nothing. For example, Brazil has already said they have about 5,000 children with microcephaly. Even in a conservative estimate, you can expect 10,000 or more children to have microcephaly by the end of the epidemic. So these are children who require care for the rest of their life. So 10,000 children, maybe each requiring $10,000 or more of care for the rest of their life. This is easily a $5 billion price tag. So, potentially very expensive. And so we need instead to invest the money up front to prevent these cases.
And preparing, I guess, in advance. I mean, if there's one thing that should be the takeaway from Ebola is be prepared in advance, correct?
Yes. And public health systems don't have to be expensive. And in fact, the #1 cause of families falling into poverty is indeed poor health. And investments in community health workers and in early reporting systems can go a long way.
Kate, thanks so much for coming in and talking to us. A really important subject, and we really appreciate the insights you just provided. Thanks so much.
Thank you.